Did you know that you can get partially or even fully subsidized hearing aids if you live in Australia? Hey guys, Cliff Olson, Doctor of Audiology and founder of HearingUp.com, and in this video, I'm talking about how to get hearing aids through the Australia Hearing Services Program. According to the Australian Council on Healthcare Standards International, Australia has one of the best healthcare systems in the entire world. In the Mirror 2024 report, Australia was ranked number 1 out of 10 high-income nations, and yes, I see that my country, the United States, is dead last out of these 10 by a pretty wide margin. Nevertheless, one of the reasons why Australia is so high on this list of best countries when it comes to healthcare is their Hearing Services Program. The purpose of the Hearing Services Program is to ensure that eligible Australians with hearing loss can access subsidized hearing services and devices, help people manage their hearing loss, and improve engagement within the community. The Hearing Services Program provides funding to service providers to provide you with hearing testing, rehabilitation, and hearing devices as long as you're an eligible Australian with hearing loss. Now, there are 2 different ways for Australians to become eligible for this program. The first way is through their Voucher program, and the second way is through their community service obligations. Let's start by talking about the Voucher program. To qualify for a voucher for either fully or partially subsidized devices and services, you either need to be an Australian citizen or permanent resident, or live on Norfolk Island, are 21 years or older, and are a pension concession card holder or their spouse, a veteran gold card holder or their spouse, a veteran white card holder or their spouse, a member of the Australian Defence Force, or referred by a disability employment service. If you are not sure that you meet these criteria, you can take the eligibility quiz that I will link in the description of this video to see if you qualify for the HSP program. Through the community service obligations, you can qualify for HSP if you're an Australian citizen or permanent resident or live on Norfolk Island and are under the age of 26, Aboriginal or Torres Strait Islander and are either age 50 or older, take part in the Community Development Program, or previously took part in this program from the 30th of June 2013 and received hearing services, or are eligible for the voucher scheme but live in a remote area or require specialist hearing services. Specialist hearing services under the community service obligations or for individuals who have very complex cases of hearing loss or who need something like a cochlear implant. Okay, so hopefully this at least helps you identify if you may or may not be qualified for this particular program. Now let's talk about what you can get under this program if you're an individual with hearing loss. But before I do me a huge favor and click the like button. It really helps out the channel. And if you are not yet subscribed to the channel with notifications turned on, go ahead and do that as well. It is greatly appreciated. And while you're at it, let me know down in the comment section if you've purchased hearing aids in Australia and what your experience has been. Okay, so if you qualify for the Hearing Services Program under their voucher system, then you have the option of getting either partially or fully subsidized hearing aids and related services. And yes, you will need to apply for a voucher, which you can do at hearingservices.gov.au, which I will also link in the description. If you decide to get the fully subsidized hearing aids under this program, there will not be an out-of-pocket expense for you to get these devices, although these are not the most advanced technologies that are currently available on the market. Of course, depending on what your wants and needs are when it comes to your hearing performance, these fully subsidized hearing aids may be adequate for you. However, you also have the option of going with partially subsidized hearing aids, which are typically newer and better technologies that are available on the market right now, but you will incur some out-of-pocket expense for these. In Australia, if you choose to go with a partially subsidized hearing aid because you want a better technology level, they call that topping up, where you basically pay the difference. Of course, the difference in this cost will depend on where you actually go. Some clinics might have a significantly higher expense to top up, and other clinics may have a significantly lower expense to top up to the technology level you're looking for. This is one of the reasons why where you go to get these hearing aids is so important. Currently, there are nearly 350 hearing service program providers across 3,000 locations in Australia. Now, this is crazy, but of these providers, 16% of them fit 84% of the hearing service program hearing aids in 2020, with the largest 2 service providers out of 350 fitting nearly half of total devices dispensed. And due to consolidation in the Australian hearing aid market, we're expecting that these percentages are even higher as of 2024. All I have to say is be very careful, Australia, because you're starting to bark up the same tree that the United States did years ago. Essentially, this hearing services program is almost entirely serviced by the largest hearing aid companies in Australia, which is extremely dangerous because typically the larger a company gets, the lower the quality goes. And the community service obligations patients are serviced nearly entirely by Hearing Australia, which is a government-funded organization. So, where you choose to go to get your partially or fully subsidized hearing aids through the hearing services program matters a lot. Most of these larger hearing service providers will dispense white-labeled hearing aids with questionable quality of care. In fact, white labeling is probably the biggest issue that exists in the Australian hearing aid market. Why? Because it's virtually impossible for you to actually know which hearing aids you're getting. Not to mention, if you need to transfer your care to a different hearing services provider, they may not be able to identify what white label hearing aids you're actually using. The thing that bothers me the most about white label hearing aids in Australia is that you're not able to price compare those devices with some other clinics that might actually have a higher quality of care. Now, as far as quality of care goes, the hearing services program in Australia actually mandates that hearing care professionals who are a part of this program perform real ear measurement. If they don't at least perform real ear measurement, then they don't get paid. However, just a word of warning here, in the United States, just providing the minimum level of care possible typically doesn't lead to an excellent treatment outcome. This is why it's extremely important that you find the best Australian hearing care professional that you can find who follows comprehensive audiologic best practices to ensure that you can hear your absolute best with your hearing aids. And the best way to find one of these excellent hearing care professionals is to go to my website HearingUp.com and find an Australian HearingUp Network member in your area. Australian HearingUp members have been vetted and are committed to providing the highest quality hearing care possible. This way, no matter what hearing aids you get through the hearing services program, you can be confident that your hearing care professional will have you hearing your absolute best with your new devices. It's also worth noting that not every hearing care professional in Australia is a vendor for the hearing services program. Most of the clinics that do not participate in this program don't participate because they provide an extremely high quality of care when it comes to hearing treatment. In fact, in order to provide this extremely high quality of care, it takes them substantially more time to perform your hearing aid treatment, and they just can't get reimbursed enough from the hearing services program to justify being a part of it. So instead of them lowering their quality of care, they just choose not to participate and they keep their quality of care extremely high. Now, as far as the services that are included in the hearing services program, they include hearing assessments, device fitting, follow-up appointments, device maintenance, extra hearing rehabilitation, specialist hearing services, and annual reviews. Under the hearing services program, you qualify for new hearing aids every 5 years unless you've had a significant change in your hearing loss, at which time your hearing care professional can petition to get you new hearing aids sooner. As far as the services go, you qualify for a hearing aid fitting every 5 years and a new hearing assessment every 5 years, which in my opinion is way too long to go before getting another hearing assessment. In my clinic, I typically have my patients come in every 1 to 2 years to redo their hearing test to evaluate if their hearing has actually changed, which could prompt a reprogramming of their existing devices or even get new devices. All that said, Australia is one of the best countries to live in if you happen to have hearing loss, and the hearing services program is one of the reasons why. The other reason why is that you have excellent hearing care professionals who are a part of the HearingUp Network that provide comprehensive audiologic best practices to make your hearing aids work the best they possibly can for you. Even if you do not qualify for the hearing services program, if you live in Australia, there's a high probability that you'll be able to find an excellent hearing care professional in your area who can make sure that you get your hearing loss treated the right way. Let me finish off this video by saying that if you'd like to learn more about the hearing services program, make sure that you go to health.gov.au for more information.